Andy McKenzie. I'm a pediatric dentist here in Hendersonville, North Carolina. I've been a pediatric dentist here for about 4 years. My patients call me Dr. Andy. I've been working with the same group of people here since we opened this office, and we've been doing great in the community, reaching out to the community in terms of serving their pediatric dental needs. Also working with the community in different ways in terms of supporting different nonprofit groups, as well as some of my own personal interests are athletics and local races, whether those are running races or bike races. My interest in pediatrics, specifically or kids, is that I've always worked with kids as far back as college when I was a camp counselor at a camp in Brevard. So I've always had an interest in providing mentorship and role modeling for kids. Also, from the medical standpoint, my background is in research, specifically with cystic fibrosis, which is a disease that affects primarily children. So I've always had a long interest in working with children and serving as an advocate for them. Dentistry, my mother was a dentist, so I think my interest in dentistry came from her. And for me specifically, the ideas of prevention and establishing good habits and maintaining a healthy lifestyle, whether it's medical or dental or just in general physical activity, those are all things that are important to me. Specifically, the reason in which I see kids and not adults is that as a specialist, you do limit your practice to a certain group, and whether that is, in my case, pediatrics, you have some people who are geriatric dentists, but for me specifically, as a specialist, I've done extensive training after dental school that is unique to adolescents and children. As a pediatric dentist, each week is filled with some variety, which is nice for me. Some of the days in the office are seeing new patients, other days are doing procedures, whether those are fillings or some extractions, but some of that time is also spent in the hospital. As a pediatric dentist, a specialist, you have credentials in the local hospitals, whether it's Mission or Part E for us. And when you're working at the hospital, you're either seeing patients who have extensive restorative needs or have anxieties where they are better seen in a OR setting, or you are doing procedures that are better done where a child has general anesthesia and those can be impacted extra teeth that are in the palate or in the mandible. I opened the office here about 4 years ago in Hendersonville and found it to be a small, growing community with a great deal of growth is going on. People generally have a concept that it's more of a retirement community, but what I've found is that there's a lot of growing families that are here with the area, with different businesses that have come to Mills River in Hendersonville. So to me, it's a growth area, and to be a part of that growth is exciting. On a personal level, Hendersonville is exciting for me, probably because of my activities outside of dentistry. I spend a lot of time doing competitive cycling, and this area is perfect for road biking, which I spend the majority of time doing, but in addition to that, mountain biking and cyclocross are both disciplines that are very big in this area. So if I'm not here at work, I'm usually on a bike on the roads or trails in this area. Great, in terms of also aside from the work that we do here in the office, we stay connected to the community in different ways, some of which in the past we've done work with Farm City Day, which is a big event that's over at Jackson Park every year. We enjoy interacting with kids there and give it an opportunity to make sure that people even know we're here, or also just emphasize dental health. In addition to that, we work with different nonprofits from time to time. Children's Family Resource Center is one of which we worked with recently, and they work with underserved mothers and children in the area and support them in their outreach efforts. We've been working also with schools on a regular basis. February is always Dental Health Month, and we'll go to schools during that month specifically, but other times, and have our dog and pony show where we'll talk to kids about improving dental hygiene and diet and supporting them with programs that they already have set up. The top 3 tips I would advise for parents in terms of maintaining their child's oral health would be: 1, to avoid juice; 2, to introduce flossing; and then 3, I think role modeling is great. So brushing twice a day, and let your child see you do it, and you'll never have a problem in your life. An important aspect to the office really is the personal nature in which we interact with each other and with our patients and their families. It's important to me to always maintain a highly personal relationship with our patients that helps with their level of comfort and happiness in the experience. And we do that in a number of ways, whether it's having the same people here all the time, so that the children know they're going to see the same assistant or the same hygienist or the same team member up front, and that helps them a lot with their comfort level. There's other things too. We have the upside down room is an area where we do our x-rays, and children enjoy the playfulness of that. We look forward to having patients come and contact us. You can find us on the web at hendersonvillepedo.com. You can also come by and see our office. We're located on Blythe Street, going out towards Laurel Park, and you can reach us at our phone number at 696-2227.